This training module is based on operational guidelines to implement enhanced global strategy for further reducing the disease burden due to leprosy. Every medical officer needs to know how leprosy is suspected, diagnosed, and treated. We need to understand what is leprosy, how is it treated, and its consequences if not treated in time. Remember the definition of a case of leprosy. A case of leprosy is a person with clinical signs of leprosy who requires chemotherapy or MDT. Leprosy should be suspected in people with any of the following symptoms or signs. Pale or reddish patches on the skin. It is the most common sign of leprosy. Loss or decrease of feeling in the skin patch. Numbness or tingling of the hands or feet. Weakness of the hands, feet, or eyelids. Painful or tender nerves. Swellings or lumps in the face or earlobes, and painless wounds or burns on the hands or feet. Diagnosis of leprosy should be done with care. It has adverse social consequences. Leprosy is diagnosed when at least one of the following cardinal signs is detected. 1. Definite loss of sensation in a pale or hypopigmented or reddish skin patch. 2. A thickened or enlarged peripheral nerve with loss of sensation and or weakness of the muscle supplied by that nerve. 3. The presence of acid-fast bacilli in a slit skin smear. During history taking, inquire about duration of signs and duration of disability, if any, treatment taken so far, and so on. In most of the cases, identification of leprosy is easy because the signs of disease are seen on the skin by naked eye. Identify the skin patches, if any. Note the number of patches. Watch for redness, hypopigmentation or swelling in the patches. Note if there are nodules around the face or ears, areas of plaque or infiltration of the skin. Test for loss of sensation in the skin patches. Definite loss of sensation in a skin patch is diagnostic of leprosy. Definite loss of sensation in a skin lesion may be detected by touching the skin lightly. Use something like a ballpoint of a dot pen or a piece of cotton wool. The person's skin is touched in different places. The person is then asked to point to each place that is touched. This exercise should be done with the patient's eye closed. If the person cannot feel the points of contact within the skin patch but does point to other places where the skin is normal, diagnosis of leprosy is confirmed. Definite nerve enlargement with loss of sensation or muscle weakness in nerve area is diagnostic of leprosy. See the nerves which are commonly affected and found enlarged in leprosy. They are: the great auricular nerve on the side of the neck below the ear is sometimes visibly enlarged. Gently feel it to make sure it is the nerve, solid, and not one of the veins in the neck which is full of fluid. The ulnar nerve at the elbow. The radial cutaneous nerve and median nerve at the wrist. Common peroneal nerve at the knee. And posterior tibial nerve at the ankle. Now test the function of each of these nerves by sensory testing over the skin supplied by these nerves and by performing voluntary muscle test, that is VMT. If there is no loss of sensation in the skin lesions and no enlarged nerves, but there are nevertheless suspicious signs. Such as nodules or swellings on the face or earlobes, or infiltration of the skin. It is important to try and get a skin smear test done. A positive skin smear in an untreated individual is a cardinal sign and is diagnostic of leprosy. There are some skin lesions caused by other skin diseases which may mimic that of leprosy. You should be aware of these conditions to avoid wrong diagnosis. Let us see some common skin lesions. This is leukoderma, milky white skin patch where sensations are intact. This is ringworm or tinea or fungal infection. Lesions are itchy. Tinea versicolor is very common, often appears and disappears. Nevus or birthmark has serrated margins and is present since early childhood. Nummular eczema may mimic leprosy, but usually there is a history of itching. It is psoriasis. Skin patches are usually covered with silvery scales. Tuberculosis of the skin, called lupus vulgaris, often shows scar of healed area in a patch with active margins. Infiltration caused by post-Kala-Azar dermal leishmaniasis will mimic the infiltration caused by MB or lepromatous type of leprosy. hence the importance of skin smear examination. Lesions of some rare conditions like sarcoidosis, syphilis, discoid lupus erythematosus can be differentiated by histopathological examination of skin lesion. Remember cardinal signs of leprosy to differentiate it with other mimicking conditions.